Okay, so in this video we're going to look at the clinical examination at the back end of a sheep. It's quite often a good place to start with your clinical examination because you can assess the whole sheep while you're starting your exam, and also you can continue chatting to your farmer and getting more history. So one of the first things that's useful to do is to do your body condition score of the sheep. There's a separate video for this, so you can go and watch that. And then the other thing you can assess while you're at the back end is the symmetry of the abdomen. So whether the left side and the right side, either of them are distended, whether they're distended equally or not equally, symmetrically even. You can also have a quick look at the wool and the skin where there isn't any wool. But the main things you're going to do at the back end are things like take the temperature. Again, there's another video that you can watch for more details about taking the temperature. While you're taking the temperature, you can look at whether there's any fecal staining around the back end, which might be a sign of diarrhea. You can look at in an adult ewe, you can look at the mucous membranes of the vulva, whether there's any abnormal discharge from the vulva, whether there's any smell to that discharge. You're also, at the back end, you're going to look at the udder or palpate the udder. So in this case, this ewe had lambs quite a long time ago and she's not been milking for a long time, so the udder's very small, there aren't any particular lumps, the teats are normal, not lumpy or anything like that, so there's no hardness, no swelling. The other thing you can do with a ewe is you can try and collect urine using a prolapse harness with a freezer bag attached, and you just leave them for 15 or 20 minutes with the harness on and the freezer bag tucked outside the vulva, and you should come back and find a urine sample. So while you're at the back end of a ram as opposed to a ewe, you're going to be looking at the testicles. So from the back end can be quite a useful place to palpate the testicles. So we're not going to do a full ram MOT now, but you've got your epididymis here, your testicles, and then you've got the cords of the testicles up here. And for general health, it's useful to notice whether there's any fluid inside the testicular sac, whether there's any coolness to it or heat. So it can be a really useful indicator because it's connected to the abdominal cavity. The testicular cavity can be a really useful indicator, and it can also be a useful indicator of rupture of the urethra as it passes through the penis, because you might have urine in the sac. The other thing, if you're suspicious of urolithiasis in male sheep, is to do a digital palpation, rectal palpation, to see if there's any pulsing of the urethra. You also might see tenesmus of the anus as well, if you've got a repeated tenesmus, if you've got urolithiasis. So I'm making him do this, but sometimes you'll see this spontaneously. That's also quite a useful test for neural function as well, as a response of the anus. Okay, so when you're examining the underside of sheep, obviously the things that are useful to look at is the feet. So you're looking between the digits, and obviously these are quite overgrown because they're indoor sheep. Very often we don't have to trim them if they're outdoor sheep. Smelling them and looking at the horn as well, as well as for any swelling above the digits. The other things you can look at the underside are the brisket for any sores. She's a little bit inflamed there. The udder is quite a useful way to look at the udder if you're struggling when you're looking at from the back end of sheep. In young animals, you can look at the umbilicus. You've got a video for that in a lamb, and any other sores on the underside of the sheep. So when you're examining the underside of a ram by comparison to a ewe, you've obviously got different structures to look at. You still need to look at the brisket because it's really important in rams when they're breeding. Brisket sores can put them off from doing their job at breeding time. The inguinal flush can be a really good, so this area should be nice and purple in breeding time, and that's an indication of the level of testosterone. But obviously the most important organs are the penis and the testicles. So the testicles, again, you can palpate them and make sure there's no lumps or bumps or asymmetry. Make sure the skin moves nicely over them. There's no heat, there's no coldness, there's no fluid. Something you can see much more easily when you've got the ram turned up than you can when looking at him from the back end is whether there are vasectomy scars. Because obviously if a ram has been vasectomized, he shouldn't be fertile. So there's no signs of vasectomy scars in this ram. And then the penis, you want to palpate as much of the shaft of the penis as you can to see if there's any lumps or pain or heat or swelling, and then try and extrude the penis. This is not something you're going to do very often unless you're doing breeding exams. That's how you extrude the penis. So you're feeding the penis up through the prep piece, taking hold of it again near the bottom, taking hold of it again to move it up again. So you're just feeding it through until it is exposed. You're also looking at the hairs on the end of the prep piece to see if there's any discharge, see if there's any crystals, if you're suspicious of urolithiasis. You're also looking for any inflammation, any discharge, which might indicate pissile rot.